Diabetes is especially a disease that education is so important in managing. And so DSMES programs provide people with the skills and the knowledge that they need to better understand their own diabetes and better know how to manage their own diabetes.
Hello, and welcome to Your Health Matters. I am your host, Vivian Ayub, pharmacist, certified diabetes care and education specialist, and founder of Sorogi. I am so excited about this podcast episode because we get to learn a little bit about diabetes self-management, education, and support, what that is and what it's not, how you can access this resource in your community, and take advantage of an evidence-based programs that have been demonstrated to improve management of diabetes. So to talk about this today, I have a really wonderful guest and someone I am just so happy I got the opportunity to meet about a year ago, work with her, and just so proud to see her transformation and growth. So I am super happy she agreed to be part of this podcast and join us today. And to talk about diabetes education, we have today Sidney Smith. Sidney, welcome to the show.
Thank you. I'm excited to be here.
Awesome. I am just happy. I know we talked about this. This is what we do. We have monthly and weekly meetings, and it's what we do. But so let's make sure people understand what diabetes education is and how they can access it. But before we get into all of that, just share with our listeners who you are, a little bit about you, what you do, and how you got involved in diabetes education.
Awesome. Yeah, so like you said, my name's Sidney, and I've been working with you as diabetes educator with Sorogi, but my training is as a nurse, so I'm a registered nurse. And I kind of just fell into diabetes education, sort of. It was never the plan. That was not what I was going to do. But when I was in nursing school, I was working as a tutor in nursing school, and I always really loved teaching. I loved the light bulb moments. I loved like facilitating conversations, getting people to understand things better. So I always kind of had a love for teaching. And then I have type 1 diabetes, so I know a lot from personal experience about diabetes and diabetes management. And so I was kind of thinking about what would be a way to kind of combine something that I know a lot about with my love of teaching, and decided, wow, the world of diabetes education, that might be a really cool opportunity. And so I started reaching out to places, seeing if anybody had an opportunity to just get involved and get some experience in diabetes education. And I stumbled upon you and your wonderful organization, Sorogi, and am very fortunate that you kind of took me on board, mentored me, and I got to jump into the world of diabetes education, and I absolutely fell in love with it. I loved the teaching. I loved seeing people develop their diabetes management skills. I loved seeing people improve their health outcomes based on the knowledge they were learning. And then I recently decided to just go do diabetes education full time, which has been really wonderful, and I really have been loving it a lot.
Oh, thank you. I know you said, I've been able to mentor you, but I have learned a lot from you, Sidney. I remember the first conversations, and I was like, wow, this person is really passionate. Oh, I'm serious. Your passion came through, and you were just so calm about it. You had that empathy. You just naturally a teacher. You just knew how to challenge, just to push enough, and you just were comfortable doing this. And I've been really impressed and super excited to see you grow in this and see how the participants have loved you and really been able to form a connection with you. So you mentioned that you've recently transitioned from being intensive care nurse to a diabetes educator full time. Why? Is it any particular reason why you decided to say, you know what, this is it? I am going to just be a diabetes educator.
Yeah, that's a great question. So I was working in an intensive care unit, surgical intensive care unit here in DC. And for our listeners who might not know the connection, a lot of the reasons that people end up requiring a kidney transplant specifically is uncontrolled diabetes and uncontrolled hypertension. And so after a couple years working on that unit, I started to become more and more frustrated that people were ending up needing transplants because chronic conditions had been poorly controlled. And I started to just become more aware of challenges in chronic disease management. And then I was caring for all these patients in the ICU, receiving transplants that they may not have needed if we as healthcare professionals had intervened earlier in the disease process. And doing diabetes education, teaching people how to manage diabetes so that they could control their A1Cs, they would know how to control their diabetes better, and so they wouldn't end up needing a transplant 10, 20 years down the line.
That is wonderful, the work you're doing. One of the frustrating thing is the resources, what people need out in the community to do better. It's not always easily available to those who really need it. And one of those resources is diabetes education. So can you explain to our listeners who might not be, familiar with what a diabetes self-management education is, what actually the program is and what are some of the benefits?
Yeah, so diabetes self-management education and support, or DSMES, we're using the abbreviation, is their programs are designed to teach participants skills that are necessary for managing diabetes effectively. And so it touches on usually 7 categories. So healthy eating, taking medications, monitoring, being active, healthy coping, reducing risk. A DSMES program is teaching participants how to manage all aspects of diabetes, because one of the challenges with diabetes management is everything under the sun can impact your blood sugars. And so a lot of times the emphasis is on eating healthy and exercising, and that's very important, but also your level of stress and how much sleep you're getting and how hot it is outside. All of those things can impact your blood sugar. And so trying to take a holistic approach to diabetes management and teaching people all of the things that can impact their blood sugar, ways to manage all of those things, and then also informing people of the risks that can happen with uncontrolled blood sugars and how to prevent the complications from those risks. Diabetes is especially a disease that education is so important in managing. And so DSMES programs provide people with the skills and the knowledge that they need to better understand their own diabetes and better know how to manage their own diabetes, because diabetes is a little bit different person to person. No two people are the same in terms of the food that they need to eat, the medications that they're going to take, what level of activity is going to be best for them. And so DSMES provides the basic knowledge and skills that people can then own and use to kind of personalize their own diabetes management.
Your passion is coming through and I love it. And I know in classes, for me too, personally, as an educator, the classes I love too is when people do all the talking. And I know usually people come to class the first time they're worried about, what am I going to say? I don't know anybody in that program. But it's always amazing to me, 10 minutes in, and they can't stop talking. And everybody has something to share. It's fun, and I love it because they're learning from each other and their experiences, and it just makes what we're talking about real. And they realize, my goodness, I did not know what I was experiencing was part of, managing my chronic condition. This is happening because of diabetes. Oh, now I get it. Oh, amazing. My doctor did mention that, but I thought that was just something out there. But I'm glad to see that 2-3 people in class have tried it and it actually is working for them. Maybe now follow up on that recommendation from my provider. So can you share with our audience what that is like, how classes usually are organized and how it happens in the virtual world, and how we try to still make it personal?
I think one thing that's interesting about our program that I really like is our program runs over several months, because a lot of times the way that diabetes education is structured, especially when you're new to diabetes, is we give you a ton of information all at once, and then we say, okay, we'll see you in 3 months. And that's a lot for people to take in. I mean, to understand carb counting and medication and insulin dosing and how to administer an insulin injection and why you should eat this many carbohydrates and all of that in one session is completely overwhelming to anyone, especially when you were just told that you now have diabetes. It's a lot to take in. And so I think that's one thing that's really cool about our program is we focus in on one small topic every week, and we can really kind of dive deeper into that, have a conversation about it, talk about how it can be implemented, and it gives people more time to kind of digest that information and think about it before we move on to the next topic. The benefit to virtual classes is people can see the PowerPoint on their screen. And so they can see it really clearly, have access to the recording also after the class. So they can go back and rewatch it and say, oh, I don't really remember what we talked about when we were talking about added sugar versus fiber, and they can go back and look at that, which is really helpful. It gives people more flexibility and the option to still get the education they need, even if they're kind of on the go. The more people that we can get into a diabetes education class, the better health outcomes we're going to have.
I find that people usually in their families, they're the only ones who have diabetes, and they sometimes feel isolated. And that also impacts how someone manages their chronic conditions like diabetes long term. There is a lot of distress, and sometimes some people even end up having depression, just dealing with the day-to-day management of a condition like diabetes. And just being part of a community or being part of a program can help a lot with that. Can you share a little bit about that?
Another thing that can kind of clue you in that maybe someone might benefit from that support and that education is if you have a patient who tells you they're not checking their blood sugar ever, or they haven't been taking their medications, or they're on oral medications but they haven't started their insulin. Those kinds of things might tell you that a patient could benefit from, one, the support of diabetes education, and two, just understanding why we're asking an individual to do those things. I think sometimes we're so busy in healthcare that we're like, okay, check your blood sugar twice a day and take this insulin twice a day. And maybe we don't take the time to explain why we're asking you to do that. And so putting someone in an education program to, one, understand the why. Are we asking you to take this medication? Why are we asking you to monitor your blood sugar? And then to be around other people who are also checking their blood sugar twice a day, who are also taking multiple diabetes medications. Like we talked back in the beginning, it can help people feel like they're not alone and help people know, there are other people who are doing this every single day too. It's not just me. And people can give really helpful advice. All of those kinds of tips and tricks that you can get from other people who have diabetes is really beneficial. But I think, like you said, just helping people not feel isolated, helping people not feel alone, because that can make diabetes management really hard when you feel like you're in it by yourself and you all of a sudden have to change all these things and think about all these things. So knowing that there are other people who are successfully doing the same thing as you can be really helpful for kind of getting people out of a funk or a rut and getting them more engaged in their own diabetes management.
Another thing that diabetes education can provide to people is access, more information about newest technology and other additional tools that they might not even be aware of, right, to help them manage their diabetes. And one of those is the use of technology. And we know there's so many newer devices out in the market, newer monitors that people don't have to prick themselves, every day to get their sugar readings. And a lot of our participants, they're hearing about it for the first time in our programs. So can you talk a little bit about helping people understand technology, how to engage successfully with it, and most importantly, get access to all those newer tools that we have available so that they can improve their quality of life and overall management of diabetes?
Diabetes tech is wonderful and is changing constantly, so it can be very hard to keep up with. But one thing that I think is beneficial about diabetes education, or the role that diabetes educators can play in this, is really having conversations with patients to figure out what technology is going to be the best for that specific person. Because I think that sometimes we're like, new technology, this is going to be great, let's give it to everybody, but that is not always the best. So That's something that diabetes education can help provide is, okay, let's have a conversation about continuous glucose monitors. What are they? How do they work? What do you as a patient need to do when you're on a continuous glucose monitor to engage with that and make sure you're actually using it? Because CGMs are great, but if you never look at the information that it's giving you, then it's just something on the back of your arm. We were working with this individual. She kept having a really high A1C, and we just couldn't figure out what was going on. And in our conversations one day, just talking with her, we had her come in, we were kind of looking at how she was using the pump. And what we realized was she was not inputting her carbohydrates into the pump. And so for those of you who don't know how insulin pumps work, you have to enter the amount of carbs you're eating in order for the pump to calculate your bolus insulin. So if you don't put your carbs in the pump, you're not getting any bolus insulin. And so you end up with really, really high postprandial blood glucose levels. And so we kind of figured that out, and we continued to have a conversation with this individual and decided to just try standing dose multiple daily injections. So for every meal, you're just going to take this amount of insulin. Let's see how it goes. And she dropped her A1C, I think, from 13 to 9. And so that's just a really good example of just throwing out technology to people because it's new and it's there isn't always the best option. And diabetes educators can really fill a role of, one, assessing where the patient is with their understanding of technology and their willingness to use it, and two, having conversations, whether it's in an individual setting or a group setting, about what are the benefits and the drawbacks to this technology, what's expected of you when you're using this technology, and what can this technology do for you. And so I think it is a really good way to match people with the right technology. There's tons of stuff out there, but just like our medication regimens are individualized to different people with diabetes, so should our technology recommendations.
That is so good. So we talk about this, but let's bring it back, because technology, all this amazing tool, not everyone has access, like we've mentioned. What are some of the frustrating things that you have to deal with as a diabetes educator that keeps coming time after time, and you don't feel like we're able to move the needle on it? What are some of those, if you don't mind sharing?
I get very frustrated a lot of times knowing that there are certain technologies out there that might be really beneficial to a particular individual, but it is not accessible to that individual because of insurance coverage, I think is the biggest thing. And that could be newer medications are often more expensive. And so sometimes you have patients on what might not be the best insulin regimen for them, simply because NPH insulin is way less expensive than a Lantus insulin pen. And so maybe we have someone on NPH instead of Lantus from a cost standpoint, when Lantus might be the better option for them. So just access to medications and access to technology. I think the biggest thing that diabetes educators have been kind of working on or frustrated about for the last year or so is just trying to get more people access to continuous glucose monitors. The data is out there that continuous glucose monitoring really can help reduce A1Cs. And I think just helps patients have a better understanding of what's going on with their blood sugars. If you can see how high your blood sugar goes up after you eat a certain meal, then you're way less likely to eat that meal again. You might make a dietary change, or it's easier to just have a conversation about, what did you eat? And then you saw this, how can we change that meal? Let's try it again with this modification that we just made and see what happens to your blood sugars. And so I think knowing that they can improve people's diabetes outcomes, but knowing that it's not accessible to everyone is really frustrating, right? Because in theory, it's accessible. You can pay for it out of pocket, but even the Freestyle Libre, which is the least expensive one on the market, is like $120 to $150 a month, and that quite simply is not accessible to a lot of individuals. Food insecurity.
Yes.
I've noticed that a lot with my patients, where I'm talking about, do you eat 3 meals a day? And if the answer is no, one of the follow-up questions I like to ask is, are you not eating 3 meals a day because you have a hard time paying for groceries? Or having a conversation about that, do you ever have a hard time paying for groceries? Are you skipping meals because you can't afford them? And a lot of times the answer is yes. And so you kind of get into this situation where providers are like, why aren't you eating 3 meals a day? Why aren't you eating healthy? And it's because patients can't afford healthy food, especially as the price of groceries is going up. And so being able to help connect individuals to resources that can provide healthy foods is really helpful. But that also gets back to access to medications, access to technology, access to healthy food. it is just simply not fair. And depending on where an individual is coming from and what their socioeconomic status is, the options that are available are very different.
And for me, one of the frustrating things is not just the access to nutrition, but I think sometimes we refer people to programs and we don't understand culture, what food means to people, what kind of food they are available to them. And then people end up getting information about nutrition that they really cannot apply. The one thing about us in DC, and you learn it quick when you're here, is it's such a diverse community. You have people from all over the world. Even here in the US, you have people from down south, from Alabama, Tennessee, every part of the world. You could find that in your program. So I think diabetes education and really good diabetes educators are really aware of that and try to make sure that the program that they put together reflects the community that they are serving and it's culturally tailored so that people can benefit from that information that is provided. One thing I don't like, it really annoys me, it's when we just give out these pamphlets, at the office, just here, eat healthy. And people are looking at this and none of the food on there, there's things that they have familiar with, let alone can afford sometimes. So it's very frustrating sometimes not having access to the right tools and the right resources and materials to share with participants because they cannot relate with what they are seeing. You have to also think about the family. You cannot expect people to cook one set of meals for the person with diabetes and then everybody else is enjoying pizza night and they have to just stick in their corner with a boring salad. No, it doesn't work like that in the real world, right? People don't make two separate food, they eat as a family. So we have to think beyond that person and also think about the family as well and what kind of support system they have around it, because that makes a difference. One more thing, Sidney, I wanted us to talk about is the fact that you and I, we work in DC, but we don't live in DC. We're not originally from DC. Can you talk a little bit about how you've been able to build trust with the community? I want you to share in your own words how you've been able to come to a community that, did not know you didn't grow up from, around here, but have been able to build trust in relationships where people are open, they can share, and you've been able to be part of their diabetes journey.
Yeah, that's a great question. I mean, I remember you told me when I first started, it's going to take a little bit of time for people to warm up to you, but you just have to keep, showing up and being consistent. Because I was very intimidated to start because I'm very young and very white and did not grow up in the community that I was engaging with. Who am I to come into this class and pretend that I'm the expert on how to manage diabetes when I don't even necessarily understand the social circumstances or the life circumstances that are going on. So I was really intimidated, but I think that was a good thing because I think it made me listen a lot more, especially in the beginning, and really trying to approach class with, I'm not the expert, I'm not going to have all the answers, and I want this to be an opportunity for people to share. And I think admitting that is always a really good place to start. Being willing to say, I don't know the answer to that, but I'll find out. Or that's a great question, but I don't know. Let's talk about it. What do you think? I think it kind of makes you more approachable as an educator because it's not like you have all the answers and you're going to tell someone what to do. It's like, no, I don't know the answer either. And I think another thing that's been helpful, and I recognize that not every educator is in this position, but I have diabetes. So I'm trying to manage my own diabetes. And so that was sometimes helpful in conversations too, to be able to say, this is something that I struggled with, or this is something that I did recently that was hard, also kind of makes you a little bit more approachable because it's not like, oh, here's this person teaching about diabetes. They must have their diabetes super perfectly controlled. To be able to say, I struggle with that too. There are days that I eat what I know I'm not supposed to and my blood sugar's 300 and I know it's because of what I ate. Let's talk about what you do in that situation, I think was also really helpful. But the biggest thing was just, I think, really listening and trying to meet people where they're at.
And you have done a wonderful job. I'll tell you that participants just love you. It's been a team effort. There has been a lot of back and forth, a lot of respect, and a lot of trust. So you have done an amazing, amazing job. All righty. Final question for you, Miss Sidney. We always try to wrap things up, providing practical tools and advice for our listeners. So how can people and providers know about diabetes education programs in their communities? What's a place they could go to get access to this information so that they can look up a program in their neighborhood and join, and providers can refer? So what's a good place that people can go to know what's available to them?
So diabeteseducator.org, you can click on their Living with Diabetes section, and they have a way to find an education program. And so it will connect you with education programs in your community, whether that's group education programs, whether it's individual education programs. It will give a lot of resources for people so they can kind of consider what programs are going to work best for them.
That's beautiful. And we're going to put that resources there in our notes section for this particular episode. And what about people who might not be from the United States? What are some good websites, if you know any, that people can go to just get information about what diabetes education is and how they can learn really basic skills to survive and just do well?
I always love the ADCES website. So the Association of Diabetes Care and Education Specialists has a lot of great resources available. So even if you can't take a class, also Juvenile Diabetes Research Foundation has a lot of like educational videos on their website. So does the American Diabetes Association. So all of those kind of big name diabetes organizations can provide a lot of tools or short videos with diabetes education if you can't access a class.
Beautiful. And one final thing you want to leave our listeners with, what's one thing people can do today to begin to improve their diabetes management?
I think one thing people can do is just share your diabetes story with a friend, whether it's a friend who has diabetes or doesn't have diabetes. Sometimes just telling somebody else your story and letting them know where you're at with your diabetes management helps you feel less alone and feel more confident in your ability to manage it.
Awesome. Thank you so much, Sidney. It's been so much fun talking to you today. I know we could go for hours because we have so many beautiful stories we could share, but I am so happy that you decided to join me today. Especially grateful with all the knowledge and information you provided to our listeners. I can't wait for our next episode where we get to break down the different diabetes technology and also how people can incorporate it in their daily lives. So super, super grateful for you. Thank you so much, Sidney, for coming to the show today.
Thank you for having me.
All right. And that concludes our show today. Thank you all for listening. If you like the show, please go to our YouTube channel and share the information with friends and family. We're on Facebook, Twitter, Instagram. And please, we'd love to hear from you. Drop us your comments, questions, and recommendations for future shows. And until next time, remember your health matters.